So people typically get referred to us after any heart event. So that could be a heart attack, valve surgery, open heart surgery for bypasses, stenting. Some people are higher risk, so they have not had an event, but they've got a lot of risk factors, and I personally see those patients as well. Well, what we want to avoid is the weekend warrior syndrome, where people don't do a whole heck of a lot all week, so they don't exercise on a regular basis. And they justify playing hockey by saying, you know, I go out there and I sweat and I'm working hard, so I'm in shape because I play hockey. But the reverse is true. We need to be in shape to play hockey to avoid the risk. In order to avoid any untoward events for your heart and other injuries, I think we need to have a high level of aerobic fitness as well as muscular fitness, flexibility. Overall, a good level of fitness to be ready for the demands of playing hockey. When we retire and have more time to play hockey, if we used to play hockey at a fairly competitive level or maybe at a recreational level at a younger age, as soon as you lace up those skates, all of a sudden you're 20 or 30 years old again, and this competitive nature comes out in an activity that is high intensity, stop and go. So the demands on the heart at that time are very high. And if you're not ready for it, this is when we run into problems. So we'll even see the NHL players warming up, and all minor hockey teams do a warm-up before any game. And it's as easy as just skating around the rink. You may or may not have a puck, so you're doing a little bit of stick handling, doing a few stretches. Just getting that body temperature up there, it gets your muscles ready, and it also dilates the blood vessels in your heart to allow more blood flow. Yes, so there's a reason that we put defibrillators in every arena in the city, and I think we're going to see this now across Canada and around the world, is because defibrillators are more accessible now. We can get a defibrillator for $1,000, so cities can afford this. But we see a lot of events where people have been, say, at the cottage all summer, they haven't done a lot, you've been sitting around a fire, drinking beer, and eating hot dogs or hamburgers, and then the hockey season starts up, and you get the boys together, and you're gonna join a recreational league, or what we call a beer league. And for good reason, because you're going out on a Sunday night, you're taking the latest ice time that costs you next to nothing, and then you're going out for beer and wings. So the people who are often playing hockey are more advanced in age in these leagues, and they may have more risk factors for heart disease, or they may have this underlying disease that they don't know about. And unfortunately, when they push themselves to that extent on the ice, they find out the hard way that they've got heart disease. Not every heart event requires a defibrillator, so you may not have what's called sudden death on the ice. And ironically, sudden death doesn't mean that you're done, because we bring people back from sudden death. It simply means that if we don't shock that heart, you're not coming back. So the importance of a defibrillator is there. But also you can have either angina, which is chest discomfort, for which you can take nitroglycerin, but people don't always have the nitroglycerin. Or you can have a full-blown heart attack, in which case you would need to be transported to your closest emergency department, or maybe directly to the Heart Institute to have an angiogram and see if there are any blockages that need to be addressed. So it can vary from person to person, and I think it's important, if people are feeling anything out of the ordinary that comes on with physical exertion or even with emotional stress, they should report that to their doctor and pay attention to it, and maybe there are some investigations to be done. So if you're reading a medical textbook or if you ask Dr. Google, what is the definition of angina? It'll often say central chest pain radiating to the left arm. And in my 25 years at the Heart Institute, I may have seen that 25 times. And a lot of the other times, people will describe different symptoms. But this onset with physical exertion that goes away when you rest, that should be a warning sign that you need to speak to your physician and have this investigated. Very important thing for any team, whether it's a recreational team, competitive team, is to have an emergency action plan. So when we're looking at minor hockey teams, there is always a safety person or a trainer who is there. And that person will have designated a parent who is at most games, most practices, and will be able to work with the trainer or safety person in order to call 911 in the event of an emergency and make sure that the Zamboni doors are open, that the Zamboni is out to allow access for EMS or the ambulance to come in. So in a recreational league, an adult recreational league, oftentimes you will have no one in the stands. It's just people getting together and playing hockey recreationally. So it's still important to have an emergency action plan. So maybe have more than one person designated as this call person or a safety person, and try to decide as a group how they're going to respond to any emergency, whether that's a bad fall, a concussion, or unfortunately a heart event such as a cardiac arrest. Well, I think we do see more heart events because of the anaerobic nature and, as you say, short bursts of exercise and then coming back to the bench and sitting. So there's really not a lot that you can do aside from knowing your own limits and not pushing yourself to your maximum. So not thinking that you're 20 or 30 when you're 60 or 70 years old on the ice, but being prepared and really preventing. That is the best thing. That is key, which means not only going to the rink on Sunday nights at 10:30, but doing something aerobic every day, and ideally including some strengthening exercises a few times a week and maintaining your flexibility. So all of your components of fitness should be up to snuff if you're going to push yourself on the ice. Okay, well, I guess this is where cardiac rehab comes in. So the patients will typically be referred by either their surgeon or their cardiologist to cardiac rehab in order to learn about what has led them to the Heart Institute, why they had their event, in other words, their cardiovascular risk factors. So understanding your risk factors, taking your medication as prescribed, and then following the guidelines that we give them. And if someone wants to play hockey or do any other activity that is beyond what is comfortable or a moderate pace, such as hockey, which is high intensity, we'll send them for a stress test. So we'll send them for either a bike test or a treadmill test, and we will be able to see if there are any changes on their ECG when they push themselves to maximum effort, or if they're having any symptoms that are similar to their heart event, and we'll be able to prescribe exercise accordingly.
So there's hope for those people.
Absolutely, yes. So it's not like you're never going to play hockey. And I've personally had patients over the years who have had a cardiac arrest. So they typically died on the ice and were brought back due to the fact that the defibrillator was available and someone knew how to use it, called 911, they were transported here to the Heart Institute, and I asked them what they would like to do, what are their goals, and they tell me they want to hit the ice again. And we make that happen. If that's what they want to do, we will do everything we can to get them back on the ice safely.